Hi everyone, my name is Sarah. I'm a registered nurse. I've worked in CVICU, ER, trauma, and surgery, giving you an at-home treatment regimen to follow. This is going to be a treatment regimen that incorporates all three of my videos. This is for people that can treat at home and are stable right now. If you're sick, help us all out and quarantine. If you live alone, great. Have people bring supplies to your doorstep. If you live with other people, pick a room of the house. Hopefully you have your own bathroom. Have your family or your roommates bring supplies to your door. Cancel everything and call for reinforcements. You are going to be in that room focusing on hydration, rest, lung therapy, oxygenation exercises, sleep, and getting better. Supplies, you're going to need water, decaf hot teas, broth soups, lemons, a thermometer, and extra linen, and ways to keep your area clean. A pulse oximeter will be very helpful at this time. You put on an unpainted natural nail, take some breaths in and out, and it'll tell you how much oxygen is going into your blood. You need to be 90% or higher. If you're hovering around like 90 or below, call somebody. You're gonna need a little help. Pulse oximeter, get one. Over-the-counter meds that I think would be very helpful are Tylenol and Benadryl. Consult your doctor. These are over-the-counter. Use your best judgment. Follow directions on the bottles. Boost your immune system with supplements. B, C, D, E, fish oil, CoQ10, and zinc. Here comes the treatment part, which is the most important. So listen up. The way you're going to fight this virus and win is through hydration. And I will explain why. This virus, once it leaves the upper respiratory tract, is creating pneumonia, thick mucus sacs that will clog up your lungs in layman's terms. So you're not getting oxygenation into your blood, which you're losing oxygen to your body, and it's very dangerous. So you need those thick mucus sacs to thin out. And what does this is hydration. You need to set an alarm for every 20 minutes. You have to be drinking every 20 minutes to fight this. And whether it's a broth soup, water, a hot tea, coconut water, lemon water, you have to hydrate. Hydration will also keep your airways open. The airways will constrict if you're dehydrated. Drinking fluids also helps regulate your body temperature. And equally important will be lung therapy exercises that will be in this video as well, so keep watching. Keep a log of your temperature. Take your temp every hour or 2 hours. If it's an under the tongue, don't talk. Wait 10 minutes if you've had something to drink. You can also get an accurate temp up the butt, but don't put it back in your mouth. Tylenol and tepid baths will help control your temperature. You're gonna need to nourish yourself. Apparently the virus makes people very nauseous, so sip on broth soups, no dairy. Teas, water, lemon water, you're getting the picture, right? It's all about hydration and nourishment. And you'll also be adding in lung therapy exercises during waking hours. You wanna starve the virus, so dairy, white flour, white sugar, or red meat, you're feeding it. Don't do that. Starve the virus. You need sleep. The body will heal when it sleeps. Take your Benadryl at night. You can even take it during the day, but you really need to be drinking water throughout the day to keep those thick mucus sacs thin. You need to stay clean. Your area clean and disinfected. This fever might make it wet, then dry again. A steam shower will help your cough. Your temperature is high, do a tepid bath or a cooler shower, but a steam shower will be really good to help that cough. Keep your stress low. Anyone that might be causing you stress, delete, silence, mute, turn the TV off. You just relax, watch something funny, read a book, and just focus on hydration. There's great meditation apps on your phone that you can use for healing, for sleep, for anxiety and nervous system stress reduction. Use those apps. The main takeaways: hydration every 20 minutes. Keep yourself clean. Keep your temp under control. Nourish yourself and get your sleep. And also, lung therapy exercises are detrimental. Hey everyone, it's Sarah again, registered nurse. This is a basic video of what pneumonia is. I actually used to tutor this subject, so I'm excited to talk about the gas exchange that happens in the lungs between the air and the blood. In order for you to have a good understanding with regards to pneumonia, it's important that you understand the basics of what happens when you take a breath in. When you take a breath in, air enters your lungs, goes into these branches called bronchioles, and at the very end of the bronchioles, there are these little balloons. They almost look like clusters of grapes, and they're called alveoli. So the air enters those. At that same time, your heart is pumping, right? Pump. So as the heart pumps, it pushes blood out of the heart and into the lungs, and capillaries meet at these little balloons. Took that breath in. You've got your oxygen here waiting for the blood. It comes in and there's a beautiful exchange. This blood that was deoxygenated will take the oxygen, and now it has all this great oxygen. It's going back into the heart pump, and it goes out of the heart to the body. That's how the air we breathe and the blood in our bodies communicate, okay? When the virus enters the eyes, nose, or mouth and goes into the lungs, we have a healthy cell here. We've got coronavirus here attaching to the receptor. It enters into the cell, it's replicating, and then it makes our healthy cell explode. It's doing that over and over again, which is causing the innards of the healthy cells to leak into our lung area. But not only that, but our immune response is being triggered. And since our immune response has never seen this virus before, it's not regulating itself. Our white blood cells are going in for battle, and they're meeting up not just with the coronavirus, but our immune response is attacking healthy cells as well. There is an enormous amount of not bloodshed like in a battle, but cellular shed. So that's creating thick mucus and pus in the alveoli and a lot of inflammation around the alveolar sac. That's what pneumonia is. Everything's getting inflamed. It's making the membrane around these little delicate balloon sacs permeable to fluid from the outside. So fluid is going into these sacs. So when the blood is coming up to our little capillaries to try and get some exchange, it can't because it's full of fluid. Our blood that needs oxygen is getting shut down. So that's how people are losing oxygen. So hopefully after that explanation, you now know what pneumonia is and why people are losing oxygen. So those fluids and the mucus that's in those sacs really needs to be thinned out. Hydration does this, and I'll tell you how. Because the lungs are filled with thick mucus and pus as the byproduct of the battle, the cellular shed, warm fluids will help thin that pus out. Imagine you have thick, pussy mucus sitting on your countertop. If you just leave it there, it crusts and gets even harder, right? Well, if you put warm water on it, it thins out and you can clean it up. If you put freezing cold water on it, it doesn't work as well as warm water, right? That's why drinking broth soups, drinking warm fluids, sipping on teas, room temperature water. It also helps being in a nice warm steamed bath or shower and keeping the air humidified, because you can even breathe in warm mists. You breathe in, like we talked earlier, and it's warm steam. Guess what it's doing to the fluid? It's thinning it out. So you've got your fluids, and you can also do steam. And if you're actively sick, you need to be pushing fluids every 20 minutes and hopefully keep you at home, healing at home. That's the goal. And here comes the lung therapy. Hi everyone, it's Sarah again. I'm here to coach by explaining to you how you can keep your lungs oxygenated and healthy. There's 3 ways to do this. 1, breath work. 2, positional therapy. And 3, physical exercises. Deep breathing is extremely important, especially if you're sick with this virus, because when you take a breath in, the air goes into these little balloons. The balloons inflate full of air. These balloons will collapse if you're not doing deep breathing exercises, especially if they're full of mucus and fluid. Do deep breaths in so they don't collapse. They stay open and you can get better oxygen exchange. Every hour, set your alarm. You'll do 6 deep breaths, and at the top of each inhale, you're gonna hold for 5 seconds. It looks like this. Exhale slowly. At the top of the 6th inhale, you're gonna hold And then after 5 seconds, you're gonna cough. That's gonna start moving some of that mucus that's building up in the alveoli so you can cough it out. So breath work every hour. Now we're gonna move on to positional therapy. After that 6th breath in, you're gonna wanna lay on your stomach for a little bit. The reason to lay on your stomach is because the lungs are further back on the body. So if you're laying on your back, you're kind of pushing on the lungs and they can't fully expand. Do rhythmic breaths, deep ones, in and out. Get full expansion of those alveoli. It'll increase lung health and oxygenation. Lay on your stomach for a little bit after that 6th breath every hour. Positional therapy also works by switching it up side to side. Imagine you have a bunch of mucus built up on this side and you're laying on this side. Well, this lung is getting great oxygen exchange, right? Well, this one isn't. You need them both to be getting good oxygen exchange so one lung doesn't start collapsing. It's very important that you switch it up. You know, your hydration alarm is set every 20 minutes. Go ahead and do positional therapy every 20 minutes. You can also do physical therapy where you can lift your arms up. The lungs don't have muscles. The lungs not a muscle. The diaphragm does that. That's what lifts up and opens your lungs. So you need your diaphragm to help open up your lungs to get oxygen inside to those balloons to get the exchange. So how about you help your diaphragm out every hour by lifting your arms up? It'll expand your lungs. It'll also be good exercise. So lift those arms up. You can do this a few times. That'll help you. So those are 3 ways you can get really good oxygenation through this time. Breath work every hour. Then lay on your stomach. Do rhythmic, big inhales, exhales. You can do positional therapy by going side to side. You can do physical exercises where you're lifting your arms up, opening up the lungs. If you're a young person or an older person and someone's helping you, they can do percussion on the back of your back. And that's gonna help loosen the phlegm and mucus so you can cough it out. The hydration therapy can thin it out. There's a lot of people that are getting this and that will get this, but now that you have tips on how to heal yourself at home, you should get through. Please share this video. Let's save some lives together. And from my house to yours, take care.